Hi, let's talk about intrauterine insemination. Popularly called IUI, this is a simple procedure for introducing washed sperm directly into the uterine cavity of the woman during ovulation to enable conception to occur. It's usually carried out in conjunction with medications. Clomid could be used, gonadotropins could be used, and this increases the chances of ovulation occurring. In a few patients, the client's natural cycle is used, and the IUI procedure is carried out when a natural ovulation occurs. Intrauterine insemination aims to increase the number of motile sperm cells that reach the fallopian tubes, thus improving the chances of fertilization occurring. IUI is recommended for couples with mild male factor infertility, couples with unexplained infertility where the cause of infertility has not been found, women who have ovulation challenges, and couples who require sperm donation. Couples in same-sex relationships could also benefit from it. In preparing for an IUI, it's always important to know that it's an office procedure, and the couples are expected to be at the clinic 1 to 2 hours before the scheduled time. The clients would have had the ovulation induction before this and HCG given about 34 hours before presentation. While the procedure lasts a few minutes, sperm production and preparation could last more than an hour. The semen is produced by the male partner and handed over to the health personnel at the clinic for sperm washing. In cases of male factor infertility, where the male semen is not suitable for use, donor sperm cells are used. The woman should ensure she takes her HCG injection before coming to the clinic. The IUI procedure is carried out 34 to 36 hours after the injection of HCG. In the procedure for IUI, a cortical speculum is inserted into the vagina and the vagina is cleaned with saline. The washed sperm is then aspirated into a small plastic IUI catheter and introduced through the cervix into the uterus of the woman. The sperm is pushed and deposited gently into the uterus of the woman. The procedure lasts only a few minutes. IUI could be complicated by ovarian hyperstimulation. Because drugs are used to stimulate the ovaries to produce more than one follicles, there's a risk of hyperstimulation of the ovaries occurring by the gonadotropins and hence forming large cysts. Ovarian hyperstimulation is very common in patients with polycystic ovaries. This cyst could rupture and leak out excessive fluid into the peritoneal cavity of the abdomen, resulting in weight gain, abdominal pains, and swelling. The patient may notice she's passing small quantities of urine and occasionally may have difficulty breathing. This problem usually occurs within 1 week of HCG injection and in most cases resolves within 3 weeks. The condition could be avoided by using a low dose of the medication and monitoring the growth of the follicles in the ovaries during stimulation with transvaginal scans. Despite these precautions, some women still go ahead and develop ovarian hyperstimulation. Mild to moderate forms of this condition could be managed at home with your doctor prescribing pain relief medications and encouraging you to drink lots of fluids. Follow-up in the clinic is advised. Severe forms of hyperstimulation may need drainage of some of the excess fluid that collects within the abdominal cavity to reduce the bloating and the pain which occurs from it. It usually allows the condition to resolve quicker and usually improves the symptoms of the woman. In some cases, patients may need to be hospitalized for proper care and monitoring. Another possible side effect of ovarian stimulation is the presence of multiple pregnancy. Fertility treatment has increased the number of multiple pregnancies, including twins, triplets, quadruplets, and so on. Clients who get pregnant with more than one fetus at a time run an increased risk in the pregnancies for both mother and the babies. This risk could include the risk of miscarriage in any of the trimesters, premature birth before 37 completed weeks, and the presence of birth defects in one or more babies. And then women could suffer maternal challenges such as pregnancy-induced hypertension, pregnancy-induced diabetes, and the risk of having a cesarean section. Antepartum or postpartum hemorrhage could occur in these women. By way of follow-up, 2 weeks after the IUI procedure, the client is expected to come in for a serum pregnancy check. However, in some persons, they may notice the commencement of menses before this time, indicating that the procedure was not a success. 1 week after the HCG administration, the woman will be instructed to visit the physician for an ovarian check. This is to ensure that the ovaries have not over-responded. This visit may not always be necessary. Women who get pregnant following an intrauterine insemination are counseled to see their healthcare personnel for further advice and counseling.